Welcome to Conversations about Crohn's and Colitis. I'm your host, Sonya Goins. Approximately 25,000 Minnesotans are impacted by the inflammatory bowel diseases. However, many folks are in the dark when it comes to education and empowerment. But we're hoping to change that by having an open dialogue. Joining me today is University of Minnesota physician assistant, Andrea Pitzl. Thanks for joining me.
Thanks for having me, Sonya.
Yeah, so many folks really don't know what inflammatory bowel disease is. Can you tell us what that is?
Sure. So inflammatory bowel disease is much similar to what the name implies. So inflammation within our intestine. Inflammatory bowel disease encompasses a few different terms, ulcerative colitis and Crohn's. Inflammation in our colon can be from a variety of different things, but what inflammatory bowel disease really stands apart from the others because it's really driven by our immune system, and also something that is usually has been there for some time, but also is a part of a very active process of inflammation within our gut.
And some people like to confuse irritable bowel syndrome.
Irritable bowel syndrome.
And IBD, and I'm like, no, they're two different things.
Yeah. So what can be confusing about that question is, honestly, patients with inflammatory bowel disease can have irritable bowel syndrome. Mm-hmm. So the tricky part about that is really trying to tease out what is driven by their active inflammation and what is driven by some functional irritable bowel syndrome that might not be driven by their active inflammation.
Yeah, I was actually surprised. I've had Crohn's for over 30 years, and they were like, yeah, you got IBS too. I'm just like, yeah, no fun.
Yeah.
Explain to folks, what is the difference between Crohn's and ulcerative colitis?
Sure. So, also kind of a complicated question. Seems like it would be very straightforward, but in general, when you're thinking about ulcerative colitis, that's really talking about inflammation that we see within the large intestine, and that can be throughout the entire intestine to just limited to the rectum, or something in between. But usually it's in a continuous pattern within the colon. Whereas Crohn's in general can be honestly from the mouth all the way down to the anus, and can be sometimes patchy involvement. And so if you can imagine, sometimes they look very similar. Oftentimes it's where does the inflammation exist, and what does it look like under the microscope?
Yeah, and this is more than just a bathroom disease. People are like, yeah, you run to the bathroom a lot. But it could affect other parts of your body, right?
Definitely. So sometimes when you're at the doctor's office, they might ask about other symptoms besides your how many times you go to the bathroom, or those kinds of things, because inflammatory bowel disease really can include a lot of other systems within your body, such as your eyes, your skin. Probably most commonly would be your joints can be involved. And it can be from a variety of different reasons, whether it's driven by your active or long-standing inflammatory bowel disease, or it could be another process, sometimes another process that's driven by your immune system.
Yeah, and how would people know that they have Crohn's or colitis? Because I know it's very complicated to say, okay, you have one or the other.
Yeah, so usually patients will have, sometimes they have had these symptoms for weeks, months, even years before they seek medical attention, because it's something that is not always something that people are comfortable talking about or seeking help for. So a patient usually, sometimes they'll present to their primary care provider, or and then might be referred to a gastroenterologist for specialty care, is usually kind of the course of action and when diagnosis is made.
Yeah, I know some of the symptoms are fatigue and diarrhea, anemia, but they can mimic so many other things. Is that why it's hard to try to pinpoint exactly what it is?
Yeah, and patients can have a variety of different symptoms from, minimal symptoms, where yes, they might have some source of or some findings of anemia, to severe symptoms with, several bowel movements a day, bloody stools, urgency, accidents, those kinds of things that might make it a little bit more obvious. But yeah, it really is getting these patients in and meeting with the gastroenterologist so that they can undergo the needed procedures, endoscopies, and biopsies so that we can make the diagnosis.
Yeah, and like we should tell folks, there is no cure, and there are several things that they think might cause it, but nothing definitive, right?
Right, so no cure, technically, hopefully, sometime in the horizon. But we're working on finding what's driving the source of inflammatory bowel disease. Obviously it's stemming from our immune system, but is it genetics? Is it the environment? So many other factors that, when it's all, mixed together, makes the recipe of inflammatory bowel disease. And hopefully someday we'll find that reason so that we can find the cure.
Right, and I know the University of Minnesota is doing some pretty cool things.
Yeah.
Tell me about that special, it's a new camera pill?
Yeah, so some people are familiar with the capsule endoscopy, which is essentially a pill that you take that has a camera on it and looks throughout your bowel. This can be limited in terms of how far that camera will go throughout your bowel. The specific Crohn's pill or Crohn's capsule goes a little bit farther. So hopefully it will be another imaging modality that we can use to help with diagnosis, to help with monitoring and managing the disease after patients are diagnosed.
Well, it sounds really cool.
Yeah, it's very exciting.
Well, thanks for joining us.
Yes, thanks for having me.
Okay, well, thank you. We'll be right back.